The social prescribing approach is it's a really good approach because it's very much about taking people and linking them in to community sources of support. So we tend to call it community link working or community referral. It sounds a bit friendlier and a bit less sort of medical, but it's about linking people up and finding out what are the issues for them and then helping them to access whatever it is that's going to improve their health and well-being.
The key areas of focus usually come from what evidence we find from the type of referrals that we're getting. So then we look at creative ways of combating some of these problems. So we have things like a men's cooking group, which worked really well for various reasons. It's to combat isolation, but it also combats health problems by teaching people a bit more about how to feed themselves, how to budget when they're trying to feed themselves on a really limited budget and stuff like that. There's cooking groups, there's the Men in Sheds project, which is now kicked off, and they're doing woodworking and stuff like that, which is now coming into fruition as we've got a new table in the community garden. So it's just about being creative and responding to the problems that you're finding.
The one thing that I can more identify with people is on the depression side. For simple fact, you're closed in. Your mentality builds up a wall against the world. You stop going out, you stop doing what you would normally do. Your interests are gone. What Cargom's actually done is actually helped break that wall, started get me back into my interests, which is gardening. And we've got a garden project on at the moment, and it's absolutely brilliant. And the one thing that's done is actually got me back out in the community, get me seeing other people, get me speaking to other people, and it's totally brought me out of my shell.
I've been on my own for a long time, lack of friends. I feel a lot better for it now, and I would be lost without Community Compass.
In terms of partnerships, then the partnership that we have with the GP practice is really very important. They refer about half the people to us that we work with. Some just refer to us, and that's fine because that's obviously we need the referrals to make the project work. Others have referred to us, but we've also been able to refer to them. And again, that's been good to have that two-way relationship with people. And so we've helped people to access, say, community mental health or the drugs and alcohol services. And we've been along with people to those appointments to help them to get through the door, because that's something that people can find really, really difficult. One-to-one
support combined with wider community support is one of the really effective things about social prescribing as well, because people are all different, as we know, so you have to be willing to spend that time to get to know what the right way to go is with people.
When we first started the project, we spent, whilst we were building up relationships, we spent a lot of time just going out there, finding out what was there and what service was appropriate for which person. When people are saying, yes, I would like to go to a group, we can give them lots of different suggestions in different parts of Edinburgh that do slightly different things. So there's going to be something that suits each person, because I think that's really important, that it's not a one-size-fits-all project.